Medicare is federal health insurance for anybody 65 years or over, anybody under 65 who has been on disability for 24 months, or anyone with end-stage renal disease or Lou Gehrig's disease. Some of my clients often confuse Medicare and Medicaid. Medicaid is jointly funded by the federal government and individual state, but eligibility may vary from state to state. It's for people under certain threshold and there is no age limit.
Welcome to Financially Ever After Widowhood, the podcast where we empower women to take control of their financial future after the loss of a spouse. I'm your host, Stacey Francis, President and CEO of Francis Financial, an award-winning and nationally recognized financial advisory firm. With the help of incredible guests, I'm ready to guide you through this challenging transition. Born and raised in Finland, our special guest, Riitta Schoenfeld, spent her early career in London before getting married and relocating to New York, where she started her family. She dedicated herself to full-time busy motherhood, where she became deeply involved in volunteering, working with various charities, and eventually becoming the PTA president, which I can guarantee is no joke. As her children grew, Riitta saw a new challenge and turned her focus towards health. She began managing a doctor's office where she frequently encountered people who were confused about their health plans. This sparked a passion that has continued to burn in her to help others understand their health options further. And with that, Riitta launched into the area of Medicare. That is exactly what we are talking about today. We are unraveling the maze of Medicare and taking all of the pitfalls that can cause costly mistakes, telling you about them and helping you overcome them. For women, one of the biggest expenses they have in retirement is medical insurance, and choosing the right Medicare plan is key to make sure that you live a healthy, happy, and affordable golden years, having the insurance and the health coverage that you deserve. So without further ado, please help me welcome our special guest today, Riitta Schoenfeld, talking about Medicare, the superpower of taking the complex and making it understandable to all of us. Riitta, it's great to have you here, and Riitta is going to be talking to us today about Medicare, which I get really excited about that topic, but for a lot of people, they refer to it as the Medicare maze. So Riitta, I'm so happy that you're here to kind of like debunk those myths, hopefully unravel that maze, and give the answers that real listeners are looking for today. Thank you for coming.
Thank you so much, Stacey, for having me. As you mentioned, it is a very difficult field. Medicare is a maze, and as most of my clients say that they just don't know how to go about it. It's very confusing, very complicated. So thank you so much for having me.
And how did you get into this field? What is your personal story? I mean, I feel like anyone who moves into finance, particularly in a helping profession, because you're in one of the helping professions of helping people navigate this very confusing type of insurance. Have you always been doing this work, or did you pivot to what you're doing today?
Well, that's what happened. Thank you, Stacey. So I've had an interesting career in 3 different countries. I've been in reinsurance, finance. I worked with several charitable organizations and volunteered in 2 different private schools. For example, I ran a lunch program for one of my kids' schools. Through my career and volunteering, I started noticing how I enjoy giving to the community and helping people. That led me to working at a doctor's office. It was actually an endocrinologist's office several years ago. I knew very little about Medicare then when I started, and I was intrigued about how confused so many people about their health plans. That then led me to start learning about Medicare, and then I decided to get my license. I have a license not only for Medicare, but also some other health products like life insurance, annuities, dental and vision. My company, Hayfitz and Associates, an NFP company, also offers individual and group health insurance, also property and casualty insurance. However, I concentrate mostly on Medicare as that is my expertise.
Let's just jump into it. Who is eligible for Medicare? And does it matter whether you have a work history in the U.S. or not?
Yes, it does matter. So first about what is Medicare. Medicare is federal health insurance for anybody 65 years or over, anybody under 65 who has been on disability for 24 months, or anyone with end-stage renal disease or Lou Gehrig's disease. Some of my clients often confuse Medicare and Medicaid. Medicaid is jointly funded by the federal government and individual state, but eligibility may vary from state to state. It's for people under certain threshold and there is no age limit. And when and how to sign up. You need to sign up for Medicare separately from the Social Security benefits. There is only an automatic enrollment for those who have been on disability, and it's very important for you to know how and when to sign up.
So let me stop you there. So again, just making sure everybody knows Social Security and claiming your benefit is different than the sign up for Medicare. And Social Security, depending on, if you have a widow's benefit, but typically the earliest you can claim on your Social Security is age 62. What you're talking about here is that for Medicare, that you have to wait until you're age 65 unless you've had 24 months of a disability or renal failure or Lou Gehrig's disease. A question I have, what happens if you're age 65 and you're still working and you're covered by, let's say you're working at Amazon and you're covered by Amazon's health insurance? Do you need to sign up for Medicare even if you're on a group health plan through somewhere like Amazon or a large company?
Stacey, that's a great question. Anyone still working full-time for a large employer, like in this case Amazon, anybody who has 20 or more employees can stay on the employer coverage and defer Medicare and not get any Medicare penalties. We will talk about penalties at some point.
Yeah, because that sounds scary. No one likes penalties, right?
Nobody likes penalties for sure. I suggest speaking to the human resources for Medicare requirements. Anyone who is, however, self-employed must sign up with Medicare when they turn 65. If they do not, they will get penalized by Medicare.
So that's important to know because I feel like not everybody realizes that. So I am self-employed. There's 18 of us here. Mm-hmm. Is it just that it's an organization that's 20 people and above that you don't have to sign up? Or is it that if you are self-employed, even if you have a company that's, let's say, 25 people or 30 people, that you are still required to sign up for Medicare as that self-employed person?
What Medicare considers a large company is 20 or more employees. So if you own your own company, you're self-employed, you own your own company, but let's say you have 21 employees, that would be considered a large employer. So all of the employees can stay on the employer coverage then and don't have to go on Medicare when they turn 65. However, when they're ready to retire, that would be the time when they would have to go on Medicare, sign up for Medicare. However, just remind everybody that there will be some paperwork that will be required by the Social Security Administration to show that you have had creditable coverage. That's very, very important. So Medicare doesn't penalize you for those years or months since you turn 65 and you've been on that employer coverage.
So in summary, really kind of the black and white of it is that if you're age 65 and you're on employer coverage where the company has 20 or more employees, you're probably okay until you retire. But if you are employed in a situation where there's less than 20 employees, then even if you're covered by that employer insurance, you need to reach out at age 65 to look into the options. Tell me a little bit about the penalties, because I think it's really interesting how the government has put these penalties in place to penalize people who are not signing up for Medicare that are eligible and should be signing up at age 65?
Unfortunately, a lot of people are unaware that they may need to sign up for Medicare. They either never heard from the employer, maybe they've been working for a smaller company, maybe they didn't see the commercials on TV, didn't listen to the radio.
Yeah.
It can happen, even though the information is out there. But a lot of people don't realize that. Something called a late enrollment penalty for prescription plans, Part D plan, is something that people do have to pay if they haven't had a prescription plan. Let's say somebody misses 2 years, 3 years. I have clients who actually has 10 years they haven't had a prescription plan. They have to pay penalties for life every single month. And it can be a fairly hefty fee. Could be as high as $70, $80, $90 per month. So it's so important for everybody to know what all the penalties can be. And that's why education is key in my profession, making sure that everybody understands what Medicare is about to start with. As you mentioned at the beginning, it is very confusing. And there are these penalties that may happen to people who do not sign up on time.
What I would say is unbelievably costly mistakes. And for everyone listening, don't worry. Riitta at the end is going to share her contact information so that if you have questions, you can reach out to her, because for a lot of people, I mean, the vast majority, getting a Medicare expert like Riitta to help you through the process is a not nice to have, but really a must have. Back to the question, Riitta, a lot of the women, well, men and women who are listening to the podcast today may have questions of if they're eligible for Medicare based on their work experience. I know that for Social Security, you have to have what's called 40 quarters, essentially the equivalent of about 10 years of work to be fully qualified to be able to receive Social Security monetary benefits. Are there any type of requirements for Medicare, in particular for, let's say, someone who was in and out of the workforce, maybe out of the workforce taking care of children, maybe out of the workforce taking care of other family members? Are they still qualified?
Medicare follows the same rule as Social Security. So Medicare Part A, which is the hospital coverage, that will be premium free. So $0 monthly premium for anyone or their spouse who have worked 40 quarters or 10 years of their life in the country. Of course, if somebody or their spouse have worked less than that, between 30 or 39 quarters, there will be a premium per month payable. But it's not only, as I mentioned, not only for a female or male, but if their spouse have worked those 40 quarters, that would be sufficient as far as Medicare is concerned for the Part A premium-free, Part A hospital coverage.
And can you talk to us about all the different Medicare plans? Because, I mean, I'm just going to throw a few out, but they all confuse me. Medicare Advantage, Medigap Insurance Supplement. What are all these plans? We've talked about A, which is hospitalization. We've talked about D, which is more so prescriptions. Can you lay out the different options if it's feasible to be able to do that?
Of course, absolutely. So Medicare can be complicated because of all these different parts. So they have 4 different parts of Medicare. There's Part A, which is the hospital coverage, and that covers the inpatient hospital coverage, skilled nursing facility, hospice care, home health care. Then there is Medicare Part B for boy, which is the doctor coverage, and that covers doctor visits, specialty visits, outpatient care, ambulance services, labs, diagnostic services. So that's B. So we have now covered parts A and B, and we talked a little bit about prescription plans. So let's talk about Medicare Part C, which is the Medicare Advantage plan. They are managed care plans and offered by insurance companies. Most common plans are HMO or PPO plans. Most people know about those. They work a little bit differently than original Medicare. They work in a way that they are network-based. You still need to have both Medicare Parts A and B. And don't forget, you still need to continue paying for your Part B premium. They will cover services that original Medicare covers, but they may have certain cost shares. co-pays, co-insurance amounts that patients are responsible for. Networks, I mentioned already. So those use a specific network of doctors, hospitals, labs, and other providers. Medicare Advantage plans may include additional benefits like dental, vision, hearing, maybe gym memberships that are not covered by original Medicare.
Got it.
And I like to call these plans pay-as-you-go plans, as I mentioned earlier, because they do have co-pays and co-insurance amounts.
So for me, I think of it as my ABCs, that you need Medicare A, which is hospital, B, which is doctor's visits. But then if there's the option, you can have C, but you need to have A and B to be able to have C. And C is that almost, if I'm understanding, richer coverage, additional benefits as well. A question I have, if someone has a network of doctors that they are really want to be able to continue to use, and is that where looking at Medicare C through one of these health insurance plans might be helpful? So for me, for example, I use United Healthcare, and my OB/GYN, my gynecologist, she actually almost functions as my primary doctor, and I've worked with her now for 25 years. I would want to still be able to see her if I were to go on Medicare. Is there more of an option for me to be able to have her as my doctor accepting my insurance if I do fork over the additional premium for Medicare Part C?
The way it works with these Part C plans is that they work a little bit differently from the employer coverage. However, they do have networks. So that's something that I can always help all of my clients. I make sure that I have a list of all of the doctors and, of course, prescriptions. I go through all the different options as I'm independent insurance agent. I can look at all the different insurance companies, make sure all the doctors are in network, as they are network-based, those Medicare Advantage plans. We mentioned earlier those Medigap, which is Medicare supplemental plans. Supplemental plans, you do not need to go in network, as Medicare, original Medicare, is your primary insurance. Any doctor who takes Medicare as payment, you can go to. And the supplemental plan actually supplements the original Medicare. It covers the gaps that Medicare doesn't cover, like some deductibles and cost shares. But of course, those plans do have a monthly premium, and they usually are higher than those Medicare Advantage plans. The plans are named by letters, for example, Plan G or Plan N, and these plans are standardized. That means that a supplement plan, let's say Plan G, would give you the same coverage no matter which insurance company it is from. Those monthly premiums differ in each state and may vary by your zip code. There are no health questions asked during the initial enrollment period. Most states will have health questions after the supplemental period has ended, which is 6 months. Having said that, there's no underwriting in New York. So that makes it a little bit easier in New York.
Yeah, so just going back to clarify. So A, hospital, and I'm just going back to try and, keep this all straight.
Absolutely.
A, hospital, B, typical doctor's visits. C is a Medicare Advantage plan with additional benefits such as dental, vision, as well as a network of doctors. And one of the things you want to do is work with a Medicare expert like yourself to make sure that the doctors you have are in the right network that you're choosing.
Right.
But then we also just talked about essentially Medigap plans, like a Medigap G and N. When would you choose a Medigap G and N over a Medicare Advantage C plan? Or would you do ever both? Or would you choose one or the other? What are the considerations for someone? And I'm sure there's a million considerations, but how do you choose?
Those are fantastic questions. And I go through these questions with all of my clients. They very often ask me, well, what would you do? So we start
that'd be my first choice, Riitta. Okay, what would you do? Okay, that's what you do. Okay, I'm doing that. That's what I'm going to do. Riitta told me to do it. I'm doing that. That sounds good.
Okay, so what I would do is I educate them. I explain all the pros and cons about supplemental and prescription plans. The only con about supplemental plan is that it has a higher premium than Medicare plans, and also it may not have those additional benefits like dental, vision, hearing.
Got it.
Having
And so
said
that's
that,
like the G and the N, the Medigap, again, higher premiums, maybe not some of those additional bells and
right,
whistles of dental, hearing, and vision. Got it.
exactly. The good things about the supplemental plans is that you don't have any networks. You can go to any doctor, any hospital who will take Medicare as payment. The monthly premiums are predictable. Your healthcare costs for the whole year are very predictable. You know exactly what your healthcare budget will be for the whole year. There are no surprises that you may have with Medicare Advantage plans. God forbid somebody ends up in a hospital
Yeah.
or ends
You have
up
all these
having...
additional
Exactly.
fees. Yeah. Got it.
Exactly. So you don't have to put money aside with Medicare supplemental plans like you would with Medicare Advantage plans. You can use the doctor mentioned, doctors I mentioned to it. You can go to anybody in the country who accepts Medicare. Supplemental plans also have international coverage up to a certain dollar amount. So that's just something to keep in mind. They also cover additional days in a hospital and skilled nursing facility. And I think that's pretty important for a lot of people. Supplemental plans actually give you 365 days in a hospital. Not that anybody will really stay in a hospital that long, but that's their coverage. And 100 days in a skilled nursing facility. Original Medicare only covers 20 days, but when you have a supplemental plan, the coverage for is additional 80 days, which is very nice benefit.
For me, I knock on wood, I'm very healthy and I am knocking on wood. But when it comes to health insurance, because I've seen this far too many times, the number one reason for bankruptcy is medical bankruptcy. And in my opinion, getting the policy that might cost a little bit more, but gives you better benefits is, if you can afford it, especially I would also say for women, because we do live longer, our medical costs do tend to be higher than our male counterparts. So these are really important conversations to be having, helping all of our listeners really plan for their future.
Absolutely. And a couple of things I might also add. There are a lot of people who are snowbirds. Maybe they live in New York, like to go to Florida or some other state during the winter. These supplemental plans travel with them because they can go to any doctor or hospital, any provider in the entire country, and that accepts Medicare as payment. So that's never an issue. They never need to worry about, oh my gosh, I'm going to be in Florida for 6 months. What's going to be happening with my health insurance? It's not an issue at all.
Yeah, that's great news. I mean, I'll be honest, I've thought about this for myself, Riitta. I actually am the opposite of a snowbird in the sense that when my husband and I plan to retire, we want to spend our winters in Vermont because we love the snow. That sounds good. Maybe I won't. I'm turning 50. Maybe when I'm 65, I might not have that love of the snow and having to shovel it quite as much. But it sounds like with the supplemental plans, whether it's a G or an N or the others, that gives us a lot more flexibility in where we end up retiring. And I know for a lot of people, they, like myself, don't have a crystal ball of what their retirement is actually going to look like or where they're going to end up living. We have gone through a lot, and I know we're coming up to time. So I do want to talk a little bit more about a really important issue, pre-existing conditions. And if it's a pre-existing condition that is a mental illness that you're dealing with, or a pre-existing condition that is maybe you've dealt with cancer or you have diabetes, or gosh, I mean, the list goes on. What happens when you're moving off of your employer coverage or your private coverage to Medicare for these individuals?
Well, Stacey, the nice thing is that when you turn 65 and you go on Medicare, there are no health questions asked. That is your initial enrollment period. No health question asked. So you can sign up with any one of these plans, supplemental plan, any one of these prescription plans.
That's amazing, Riitta.
Yes.
That is amazing, because my understanding, and you're much more the expert, that there are health questions sometimes asked for private insurance if you're going out there and trying to get insurance yourself.
Right. Of course, having said that, if anybody does want to change their health plan after 6 months, 6 months is the supplemental sign-up period. If anybody wants to sign up after that, somebody who is outside of New York, in New York, fortunately, there are no health questions. most other states, there are health questions. That's why education is key in my profession, as I do want to make sure and stress the point that let's look at all your different options. What if, God forbid, a year, 2 years down the line, you end up getting some kind of major issue, heart condition or something like that, COPD? You may not qualify for that supplemental plans that you were thinking of getting
originally.
Couple of years down the line. There will be health questions, and most people do not qualify, unfortunately.
And Riitta, for people who are listening, we have people from all across the country listening to this podcast right now. Are you able to work with them if they're outside the New York area?
I'm currently licensed in 14 states, mostly here on the East Coast. Yes,
you're busy.
I'm busy. My team, there's 6 of us in our team. We are licensed in most of the states. It takes about 24 or 48 hours to get licensed in the States. That's never, ever an issue. So if anybody contacts me and say, I'm licensed in Ohio, well, we are actually licensed in Ohio, but let's say if we were not, I could say that, don't worry, we will take care of you. We will make sure that we get that licensed and we'll take care of you. We never turn anybody away.
Oh my gosh, that's so comforting and gives such peace of mind. When you think about Medicare, is there anything that it doesn't cover? And for me, the first thing that pops into my mind is seeing my mother suffer from cancer. She had breast cancer, and
I'm sorry.
Medicare was able to cover some of her skilled nursing. But when it was no longer skilled nursing that was needed, it was more help with just the daily acts of living, more like custodial care of just kind of needing some help here with getting dressed. She needed help getting dressed. She needed help eventually walking and transferring. How much of the custodial care will Medicare cover, if any?
Long-term care, also called custodial care, is not covered by Medicare. Those activities of daily living are covered only for a short period of time if somebody's recovering from an illness.
Got it. So typically they would be, because I know what my mom was covered. She was in the hospital in intensive care. She eventually was released to a skilled nursing home, and that was covered. Mm-hmm. But then by the time she was able to go home and just needed custodial care, that nursing we had to pay out of pocket for. Does that sound right?
That is correct. The full-time skilled nursing care is not covered. Home health care is covered up to 8 hours a day. Of course, the doctor has to get prior authorization for that, and no more than 28 hours a week. So long-term care is tricky, as you mentioned.
Yeah, and I feel like long-term care is, the people's opinion about it is maybe quite as strong as if you're Republican or Democrat. Maybe not that strong, but, a lot of people have really strong views, either pro getting long-term care insurance or not. But what I will say is that every family has to do what's right. How it impacted us is that my husband and I, as well as my brother and his wife, were helping supplement the costs of that care for my mom. And it was astronomically expensive, so much so, Riitta, that we had to put our house up for sale because we couldn't afford to pay for our home, pay for our kids. At the time, I had started the charity, and I still couldn't pay myself between the charity and Francis Financial because I was still really growing those. And I just think that it's a really important conversation to talk about, and that if you're not going to get that coverage, that's fine, but just making sure that you have some type of contingency of how are you going to pay for that. Sure. And, in our case, my brother and I did, and it really impacted us. And quite frankly, it's very sad. The only reason we were able to keep our house is that my mom died very quickly.
I'm sorry to hear.
As far as long-term care, can you just talk a little bit, and I know that this is kind of off topic, but what the different options are out there? This is something that you would have to pay for yourself, right? And I know there's the standalone policies where you're kind of almost buying a basket of money that can go towards long-term care. But then there are other options too that weren't around many years ago where it's a life insurance policy and you get the death benefit if for some reason you don't use it for long-term care. So talking about long-term care with your family is definitely something important of, is this something that we should be doing? And I do appreciate, Riitta, us talking about the fact that Medicare covers a lot of things, but not necessarily that custodial care.
Absolutely, yes. So I would definitely suggest speaking to an insurance agent about long-term care. Of course, the younger the person is who that's purchased for, the less expensive it is. If anybody tries to get long-term care insurance when they are in their 70s, it does get quite expensive.
Yeah, and it's one of those things where you have to get it while you're healthy. It's
Yes, exactly.
very important, so stay healthy. I know that we went through so many things. Anything that we didn't cover that you'd want to add? And then after that, I'd love for you also to share how our listeners can get a hold of you.
Sure. I guess one of the questions I often get asked, how do I check if my doctors take Medicare or if my medications are covered?
Yeah.
So that's something I can help. As an agent, I have access to all of that information. You can always get a list of Medicare providers at medicare.gov.
Oh,
so,
okay.
Yes, so that's definitely very helpful, very handy information there. Having said that, the information has a wealth of information. Sometimes it can be a little bit confusing. So to help clarify the information, speak to a licensed agent who can then assist you with all of your questions.
Yeah, and I'm just going to back up what you're saying because, Riitta, I did a tremendous amount of research before our podcast today because I wanted to be well enough informed to know questions there are. And I will tell you, it was very confusing. And what I found confusing too is some websites were really advertisements for buying their plans.
Yes.
And I figured out the ones that said sponsored under them when I did my Google search. So I ended up going to medicare.gov just to say, okay, this hopefully is a place. And it was very helpful. But Riitta, I do have to say, I was a little nervous for our podcast today because I walked away with more information, which was helpful, but almost I feel like it made me more dangerous, right? Like I've got more information, but like, no, now I'm more dangerous as well. And so, I mean, I feel so strongly of put a team together and, making sure that you have a team for managing your money, growing your portfolio, your financial planning.
Yeah.
Again, what we do. But then when it comes to health insurance, particularly, of course, Medicare, that you get your right team in place. So I'm not quite at 65 yet, but Riitta, you bet that I will be putting you on speed dial. And I have to say, it's the most wonderful investment that I think you can make. And a quick question, how do you get paid? Do people pay you an hourly fee? What does that look like? That's one of the things I actually didn't even think to ask.
Right. Thank you, Stacey. That's a great question. I get that question asked very often. There is no fee involved. I have a base salary through my company. And if there is an enrollment, the insurance company pays a fee. That's how it works. Yes.
That's beautiful.
Yes, that's how it works in insurance.
All right. So there's no negative anyone. So how do our listeners get a hold of you?
They can contact me directly. They can call me on my direct line. I can definitely supply you with that information. They can email me. And that's definitely the easiest way. We can start a conversation and set up a time to call. And then I can do my education part and then get to know my clients well. That's what I enjoy.
Love it. And so everyone listening here today, we are going to be putting all of Riitta's contact information, both phone number and email, the website of her company, so that you can reach out to her. And as you can tell, Riitta is one of the nicest people you will ever meet who is able to take a very complicated subject and make it really understandable. I have to say, Riitta, it's quite a special superpower. And so I'm so appreciative of you taking the time out of your busy day to talk about Medicare. And I just also want to just say from my heart, thank you for doing this work because it's such important work and you're making a unbelievable difference to so many people out there.
Thank you, Stacey, first for having me. And likewise, you provide such an important service, not only for women, but your podcast provides such an invaluable information for everybody. I have listened to quite a few of them, and just keep up the good work. Amazing,
Oh,
Stacey.
thank you. Thank you. Thanks for being here, Riitta.
My absolute pleasure. Thank you so much for having me.
High premiums and penalties definitely scare the bejeebers out of me. No one wants that. And understanding your healthcare options when you reach age 65 is more important than others. It's even more important for women because we see much higher expenses for our medical costs, not only today, but also through our golden years. Talking about affordability and talking about planning, it's important to make sure that your financial plan does include the expenses that you're going to face, not only from Medicare, Medigap, or Medicare Advantage premiums, but also the premiums of health coverage outside of this. So please reach out to Francis Financial if you have any questions about your health insurance concerns and whether or not you can afford them. We will put you in touch and manage the process of making sure that you have the right insurance to make sure that you are financially secure, not only today, but for the rest of your life, and making sure that you have the health coverage and care you need not only today, but also for the rest of your life. You can reach out to us for a second opinion about your overall financial plan at Stacey@francisfinancial.com, or you can visit our website with hundreds of really important articles you need to read at www.francisfinancial.com. Thank you again for tuning in to Financially Ever After Widowhood to learn a little bit more about Medicare and make sure that you're on the path to financial security with not only financial peace of mind, a full pocketbook, but also that you have the medical care that you deserve. Thanks for tuning in, and we'll see you in 2 short weeks. Thank you for tuning in to Financially Ever After Widowhood. If there's a question you'd love for us to answer on the podcast, we can do that for you. All you have to do is give us a call, and the number is 347-682-5580. Let me say that again, 347-682-5580. Whether you're working with an advisor or you're maybe doing it on your own, we invite you to reach out to us at www.francisfinancial.com, or you can email me at Stacey, Stacy, at francisfinancial.com. Our hope is to be a resource for you to help you also find a great financial advisor, whether that be with our firm or one of our trusted colleagues. Please be sure to like, rate, and subscribe to the podcast, and join us next time on Financially Ever After Widowhood.